For years, the maternal mortality rate in the U.S. has far exceeded that of other high-income countries. And at last count, it was more than 3 times higher than nearly all of its peer countries, with nearly 24 deaths for every 100,000 live births. And that is just the average. The mortality rate is a whole lot higher for Black women here in the U.S. They are dying at more than twice the rate, with 55 deaths per 100,000 live births. And while other demographics can also factor into maternal and infant health, new research published by the National Bureau of Economic Research has found that Black mothers and their babies have the worst childbirth outcomes, regardless of poverty level, parental income, and socioeconomic status. In fact, researchers explain, quote, infant and maternal health in Black families at the top of the income distribution is markedly worse than that of white families at the bottom of the income distribution. Well, we're going to break it down, and I'm joined by State Senator Liz Miranda and Colette DeJuste. She is the Dean of Nursing at Wheaton College, who's worked as a labor and delivery nurse and is a member of the National Association of Women's Health, Obstetric, and Neonatal Nursing. Welcome.
Thank you. Welcome.
So, I think we've been having this conversation for many years, at least in the last 5 years, about maternal outcomes for Black and brown women. But now we're seeing that their babies are not faring as well. And Senator Miranda, we've been talking about this for this long. Tell me what you think about or make of these new numbers that have come out of this particular study when we're talking about babies.
First, it's an honor to be here with you and making sure that we're having this conversation, because conversations are really what have led Massachusetts in leading in addressing the maternal and infant mortality and morbidity crisis, not only in the country, but here in Massachusetts. When we first started talking about this issue, we had just filed and then passed within a year unanimously in the House and the Senate when I was a representative, the Maternal Inequities Commission, which met for a year, did listening sessions across the Commonwealth, had 95% percentage of support in that commission from Black and brown people with lived experience or providers. And what we learned from that, we filed a report in April of last year. And these numbers to us are not new. There's studies every year, every month that come out that basically say America is not doing well by Black and brown women and our children. I think the shocking piece of this study is that it shows that in normal cases, when you look at any social determinant of health, income, education, zip code, marital status, and education are usually factors. And what we found in this report from the Economic Bureau is that regardless of those factors, whether you're married, wealthy, college educated, live in a nice town or city, Black women are dying more and our babies are dying more or born with lower birth weight than the poorest of white women. And that is an alarm and a bell that I think is speaking to the fact that we must be urgent in what we're doing, not only in legislative arenas like the Massachusetts Senate, but what we're doing in community, in hospitals, in teaching institutions to reverse the tide.
And I want to point out some numbers from this particular report. And Colette, I want you to respond to this. We understand that the infant mortality deaths per 100,000 live births for the richest Black mothers versus the poorest white mothers. Richest Black mothers, 437. Poorest white mothers, 350, and that number actually goes up to 653 for the poorest Black mothers. Colette, do you see these numbers bearing out in labor and delivery rooms in your experience?
I think we have seen that. When we talk to Black women about their experiences, they've always feel that there is problem, that they are not being heard, that and it cross the economic line, that women feel that they're not being heard. And that it's like they don't understand their own bodies. So when they are telling the healthcare providers that these are some of the things that are going on, they're not getting any result for them to be heard. So if women are not being heard about their issues and their problem, then that's going to lead to what we're seeing today, where we are seeing the increase in maternal morbidity and Black women dying. We're seeing that their children are not able to handle, and because of that, they born early. They have other issues that comes with it. So these babies are dying also. So it is really important that we pay attention to what is going on with the Black women that is happening. And some of the studies that are showing that we also have to take a look at the whole weathering effect that is pushing some of those things that are happening to Black women, so that we need to study them and try to see how we can decrease that rate. And we have to do it really, we cannot wait. And that is one of the studies that we're doing on birth equity, talking to these women and trying to hear what is it that they feel and what are the things that they think that could help them so that these things do not repeat with other women.
What do you think, Colette, in terms of educating nurses specifically? We also talk about physicians as well, but as the Dean of Nursing at Wheaton, I mean, what do you talk to your nurses about how to help a mother in that experience in the room with this equity lens, with this information, armed with this information that we have now collected data on?
Well, from some of our preliminary data that we're receiving from our study, some of the things that Black women are telling us is that we need to eliminate discrimination, racism, and we need to do it at the bedside. We need to make sure that women are being heard. The other things that women are telling us is that they need more Black providers. So more nurses, Black nurses to go into the field, to be nurses so that they can be able to help these women feel more comfortable, so that they can feel better about the care they are getting. We need more support groups to be able to help these women to make decisions and also to help them, to support them, because there is a lot of issue. It's not one thing with maternal morbidity. It is, the comorbidities are very high, and there's all different things we need to do. Financial support is extremely important, that we need to try to find a way to support them financially, and try to help them to understand what's going on and teach them. So we have to teach our nurses all of these different things so that they themselves will be able to help champion those patients and help the patient find a voice so that they can talk about the problems they have and how they can get a result from them.
Senator Miranda, I know that a lot of the legislation has been focused on getting more diversity into the healthcare space itself. I know there's been a conversation about doulas, doula certification, and having that extra support person in that healthcare space.
What's really interesting is I got into this work. I'm not a mom yet, because in 2017, my baby sister gave birth to a baby at 21 weeks that didn't survive. If it wasn't for a presentation by the March of Dimes, I would have never known what to call it. I was in a room with my sister who had complained the evening before about pain, and her doctor told her she was anxious and told her to take Tylenol and go to bed. And that morning, she gave birth to her daughter, Mila, 21 weeks, who did not survive. And so many of my friends and people that we know are going through the same things, because I'm glad you called it out. It's just racism. It's the structural, systemic racism that is in our healthcare system. It's also about access. It's about not looking at Black women's pain in the same ways we look at other women's pain. And women, particularly Black women and Indigenous women, and women who are underdocumented, undocumented, live in rural communities or speak another language, are oftentimes not taken seriously when they're complaining about the birth experience. And so we need to reimagine the birth experience. And legislation is my wheelbarrow. That's the thing that I carry every day in my work. And I'm so proud that I filed this year a birth justice omnibus bill that I hope to bring many communities together from Pittsfield to P-Town to help me craft this bill. But also the Moms Matter bill and act is such an important one. It's around postpartum and perinatal mental health. All of us were probably watching our TVs, hearing about what happened in Duxbury a few years ago, in Roxbury. It happened again. And we are not taking the mental health of birthing people in this state seriously. And so I wanted to make sure that we know that we have a vehicle in policy and legislation, but it's so important that we're teaching nurses differently, we're teaching doctors differently, that we're putting more budgetary sort of support for peer support groups, for groups to handle. Many birthing people are going through miscarriages or stillbirths. Many of them suffer from preeclampsia and sepsis and some other of the comorbidities of diabetes and hypertension that is impacting Black women. I just want to say one more thing is that we need to do everything. This is an and to get to greater equity and justice so that no Black woman is dying in the Commonwealth of Massachusetts and then our babies have a fighting chance. We have to do everything together. And so I just want to encourage folks who are watching the broadcast thinking like, well, what can I do? At every level of government, in every sector, beyond healthcare, we have to do better by birthing people here in the Commonwealth of Massachusetts.
Colette, I was interested about the point you were making about how the funding to get people that look like the people who are birthing in these spaces, making sure that they look like those folks. How important is that piece versus the money it seems like hospital systems are spending on implicit bias training and other things like that? And Senator Miranda mentioned it's not a this or that, it's everything all together. But it has to be that we've been talking about this for many years. It has to be more than just the training of the folks in the space. There has to be another level. And what do you see as that another level as someone who's been in the labor and delivery room?
I mean, it's important to do that training because that training will help and will sensitize the people who are working in the space so that they make sure that they understand the patients that they have. But we started in the nursing schools with our students, trying to make sure they understand, social justice and understand that the global health that people are living in and how they need to be able to help the patient find their voices and be able to help the patient explain what is happening. At the same time, we need more nurses, more Black nurses, to be in that space. And that we need to be able to do since really elementary school. We need to encourage these Black girls and Black boys that nursing is a great profession, that we're a caring profession who love people and want to show the best of whom they are, that, we use our critical thinking skills and to make sure that we understand what is happening and to be able to take care of the patient in all the ways that need to be done. So I think it's both. We need to help the people that are here now to be able to do that, but we also need to bring new people in. And that need to start since elementary school to show how wonderful it is to be a nurse and how compassionate and caring that we are and how that we can use that to be able to help people wherever they are and then lose our biases so that when students then they become nurses, then they'll be able to take care of our patient. Our patient will be able to see that the nurses that are in there look like them, act like them, to be able to feel more comfortable. Because some of the things that they ask for is to eliminate those professional, the behaviors that is happening. They want that to go away,
right,
so that their voices will be heard and they'll be better be taken care of.
All right, well, we're going to have to leave the conversation there. We certainly could be talking about this for hours now. Senator Elizabeth Miranda and Colette DeJuice, thank you so much for your time.
Thank you very much.